County Mental Health and Recovery Board is spreading the message never to trust your eyes to determine if a pill is real. The United States Drug Enforcement Administration seized more than 59.6 million fentanyl-laced fake pills and more than 13,000 pills of fentanyl powder in 2022. Commander of the TAG Drug Task Force for Trumbull County, Captain Mike Canucci, is here to tell us about the growing concerns he is seeing surrounding the pills, the powder, and the epidemic itself. Thank you so much for being here.
Hi, Lindsay. Thanks for having me.
Yeah, you have a new video out by the Trumbull County Mental Health Recovery Board featuring yourself, Trumbull County Sheriff Paul Monroe, and it mentions that you really can't tell the difference between a real opioid pill and the fentanyl-laced ones. How often are you seeing these fake pills out in the field?
We are seeing these pills quite frequently out in the field right now, and of course fentanyl is everywhere and in every drug we buy right now.
Now, the Trumbull County coroner is confirming 81 drug overdose deaths through the end of September. 8 more are pending. So it doesn't seem like those numbers are going down. What would you say your biggest concern is with the epidemic?
Well, the biggest concerns are the fentanyl and trying to stop it from coming into this country and into our communities. Just recently, last week, we were able to intercept 1 kilo of fentanyl that was coming into the Mahoning Valley, more specifically the Warren area, and we were able to work closely with DEA, State Highway Patrol, and the Warren Police Department in taking that kilo of fentanyl off the streets. So, it seems like a small win, but any win we feel is saving lives in our community.
Oh, wow. Now here at the newsroom, we are breaking down some of the data. We've been looking at some of the numbers the coroner gave us. He said a lot of people in their 40s and then people in their 50s had the highest rate of death. Do those numbers jive with what you're seeing in terms of the drug trafficking and the customers that these pills and different drugs are going to?
Well, fentanyl is a highly addictive synthetic opioid. So we fear that a lot of these users, they really don't know what they're getting. The dealers seem to mix things together, and like I said, methamphetamine, we're seeing fentanyl in methamphetamine, we're seeing it in crack cocaine, we're seeing it in just about everything. So I have a feeling the users aren't really aware of what they're consuming, and I think that's leading to a lot of the overdose deaths. Not to mention that I don't know that the dealers know how pure what they're getting is, and then they may be adding some things to it that puts it over that legal limit.
You mentioned some of the challenges you've had recently, just like spotting the drugs. You said you just had a big win with that kilo. What are some of the other challenges law enforcement faces in terms of getting the opioid epidemic slowed down, slow the supply chain? What are some of the resources that you need?
Well, I think the supply chain, I think, the borders, that's where it's coming from. It's coming from Mexico. The counterfeit pills are being mass produced by the cartels down in Mexico. There's some production here in the United States, but not to the amount that is coming across the border. And it's simple demand and supply. So as long as we have demand, they'll find a way to supply it.
All right. Important information, especially parents, caretakers watching tonight. What would you stress to them if they know that their teens or young people are trying or experimenting with drugs?
Well, there's only one safe way to take a medication, and that needs to be prescribed by a licensed medical professional and dispensed at a pharmacy, and that's the only safe way to take a pill these days.
The DEA featured pictures of Adderall on its website showing teens that this could be something that's sold to you and it's not real. In some cases could be deadly. Thank you so much for joining us, Mike. Appreciate your time.
Thanks for having me, Lindsay.